Thank you for the opportunity to introduce a systematic review, literature review organized by the World Health Organization. It is also part of the AQG update. WHO initiated this review was mainly in response to the global call on the personal level intervention during high pollution episodes. And this review focused on the real world exposures, by meaning we are excluding studies conducted in experimental settings and in occupational settings. For this review, we came up with the literature search strategies as focusing on the mainly English database, but we also, in the identified studies, we went to the local journals if that study is referred in the identified studies, and then we focused on the exposure of PM 2.5, and study types are either the intervention trials or the clinical studies. And the equipment focus on the indoor air filters and the respirators. Keywords, I'm not repeating the keywords. Sorry, this slides. Oh, okay. The keywords are the combination of air pollution and health endpoints. Since this review focused mainly on the potential health benefit for personal level interventions, currently another review focusing on the air pollution exposure solely is underway. So in this presentation, I'm only introducing the endpoints, studies with endpoint assessment. So these are the, you see the study types, the intervention tools, and also as stated, we excluded studies conducted in the experiment settings and in the occupational settings. We extracted studies information from locations, subjects, intervention periods, equipments used, exposure period, and exposures and index, and endpoints, and many results. In this flowchart, you see we started with studies with the key combination keywords used showed in the previous slides. We started with 600-something studies, and by excluding those exclusion criteria, we sort of reduced the number of study interest to 28, including 18 air purifier studies and 10 respirator studies. And further going through the literature, with commonly studied endpoints, including blood pressure and lung functions. These are the two primary endpoints assessed in the most of identified studies. You see, we further reduced the number of studies for air purifier studies to 13, and the respiratory studies to 8. This is the global distribution of the study locations. Several studies, most of the studies were in North America and Europe, several studies in China, or no studies in Africa and Southeast Asia. As stated, in most of in these identified 28 studies, especially the 20 studies in air filtration use, we observed about 40 to 80% reduction in indoor PM 2.5, but I'm not showing the results here. So and also for respiratory studies, due to the unmeasurable exposure before and after the use of mask, so no assessment on the pollution on the exposure reduction from the mask use. Here's the forest plots for the meta-analysis of the air purifier studies, primary health endpoints on the blood pressure. See these on the vertical line on the left, each dot showed the estimates of blood pressure estimated after the intervention, and you see most of the dots found on the left suggesting the reduction of blood pressure observed in the intervention studies, in the indoor air purification studies. And at end of each of the parameter, like for systolic blood pressure, at the end of these identified 6 studies were the overall estimate of the reduction from the pooled estimate of the studies. So we're now seeing the consistent changes on the blood pressure in the identified studies across the systolic blood pressure, diastolic blood pressure, and RHI, these endothelial function parameter. These are the blood pressure, data from the air filtration studies. Next slide shows the parameters on the systemic inflammation, including CRP, 6, and fibrinogen estimate in the indoor air filtration studies. Again, on the vertical line on the right shows the that's increase of these parameters. But in the studies during the intervention, we saw the reduction of these systematic information parameters of CRP and IL-6. But again, no systematic changes, patterns. It's either increase or decrease for these parameters. This is the lung function parameters in the indoor air filtration studies. These are the mostly measured in the adults. Again, most estimates on the right part of the vertical lines shows some improvement of lung function. However, the changes across studies are not consistent. Sorry for this busy table plot shows the mainly the cardiovascular parameters estimate in respiratory studies. Then again, some for the first 2 parameters, SBP and DBP, we observed some reduction on blood pressure of the mask use. On the several parameters at the bottom are the heart rate and heart rate variability. We show some, observe some improvements on these parameters as well. But again, the changes across studies are not consistent, and the pooled estimate are not always significant. So for this review, we have identified very limited personal level intervention studies globally. Studies in less developed areas are extremely needed. Collectively, indoor air filtration with HEPA filters used showed to reduce indoor PM 2.5 concentrations ranging from 40 to 80% during the intervention periods. But these studies were most have very short-term interventions, varied from few hours to days to weeks, very few across a month. Following the personal intervention, some overall summary reduction in blood pressure, increase in heart rate and heart rate variability, increase in the lung function were observed. However, the observed changes are not consistent across studies, and the observed improvements in cardiorespiratory outcome measures were in general greater in healthy adults than those in elderly and patients with cardiovascular and pulmonary diseases. So personal level intervention can be of limit. Thus far, we think personal level intervention can be of limited health benefit in reducing cardio and respiratory effects, particularly in high-risk populations. Future trial studies in much larger sample sizes with longer-term follow-up in high-risk population are in urgent needs. And we also think to mitigate air pollution exposure at emission sources are needed in near future.